if we did every woman an ultrasound, we might find like a small fibroid just hanging in there. But it does not necessarily require that much attention.
Okay.
Yeah. So again, those fibroids, they have only, most of the times they are not cancerous. 1%, 1 out of 100, it might lead into some very fast growing tumor we call sarcomas, which can grow and fill your abdomen in weeks. So that one, the risk is very low. We say the risk of turning into cancer is very low.
It's very low.
Yeah. But again, now past reproductive age, apart from menopause, which in my opinion is mild as a condition, but very severe socially, your reproductive health system now runs into cancers because age is now a risk. You've been exposed to this very bad environment for long. You sexually active, and some of the cancers have got correlation to sex.
Okay.
Yeah, some cancers, the risk factor is how many children you get. If you are getting so many, the risk is much higher. And then other new things fall into place for the woman. So apart from cancers, your uterus as an organ has got supports. It's like a house. It has pillars.
Yes.
So the pillars loosen.
Ovaries.
Yes. So you might cough and you find your uterus outside. You might, go to the toilet, and when you are exerting abdominal pressure, you find it's coming outside there. We call it pelvic organ prolapse. So it becomes now a big challenge, because it also has effects on your sexual kind of interaction. It's happening at a time when sex is a problem because of also menopause. And if you are having any chronic condition, including just chronic cough and other things, it gets aggravated.
Okay.
So, but we usually, the excellent and the cutting edge woman, we request that you can strengthen those muscles because they are weakening by doing what we call Kegel's exercises.
So you begin at menopause?
No, you begin early. This one, even after every delivery, you have to keep on strengthening your muscles because the tone is dictated by exercise.
Okay.
Just like when a man lifts those weights, the vaginal muscles have got also, they need to be exercised in terms of lifting. So the easiest way to do it, there are many ways. Kegel's exercise is defined in many ways. The easiest one is if you are going for short call, you begin, you can urinate, say, for 10 seconds. You cut it for 10 seconds. Intentionally, you release for 10 seconds. You hold for 10 seconds. But it's an exercise you can actually do while you are in your car. And you are driving. This also applies to men because of some men have premature ejaculation and other things. They have to learn on how to hold. So if you are driving from airport to town, you can imagine you'll have done more than 10 if you wanted. And it's a very easy, it's very easy. Sometimes I tell my patients that that's a cost-free kind of exercise. It just needs you to be conscious that you are doing something.
Yes.
And then that alone can sort even 50% of your problems. It might retain the uterus inside rather than coughing it outside.
Really, because I feel that is like one of the worst nightmare of a woman.
Yes, it's a nightmare.
But I just want us, maybe we highlight the aspect of now estrogens are low, and what are some of the changes to expect, and how can you boost it? Like, is there an option, or it is, like a necessary evil that everyone
in fact, among the benign conditions arising also courtesy of menopause, it's because during menopause, the sources of estrogen when I began this talk, I said the ovary is the source of it's what defines a woman. But what defines a woman is the hormone it produces, which is estrogen. So every time an egg is produced, estrogen is produced.
Yes.
So when those eggs come to an end,
Yes.
estrogen also comes to an end. It's not produced as a hormone. Estrogen is the reason behind the strength of your bones. Estrogen is the reason behind your face. So when you see wrinkles, it means also estrogen is gone down. You know, when you look at your parents, that's an effect of estrogen deficiency. You know, when you see them wrinkled, yeah? And, you know, when you look at it critically, estrogen is also what gives the muscles and the tone and everything, including the vaginal lubrication, is courtesy of estrogen. So when you get to menopause, there is vaginal dryness.
Yes.
Even urination itself sometimes can be painful. Because the urethra is very dry. Yeah, we call that urogenital syndrome. If you move further, you realize that, you know, even having sex around menopause, sometimes it's dangerous. Because we have to look for ways of ensuring that sex is uneventful. Because that dryness, some women suffer through cuts. You know, the vagina can be cut like somebody used a knife to cut it. It's such a serious thing. So sometimes we use what we call, because we do not again want to give you estrogen during that time. It can cause cancer. So we give what we call local estrogen. We give creams that you apply locally, and they make the vaginal wall a bit malleable for those purposes. Then you are able to experience some functions. There are nutritional things like isoflav or soya. Soya, it's only plant which produces, it's the only source of estrogen in plants.
Wow, soya.
Soya. Yeah. The church where I go, people try to say we are soya guys. I have no problem with that, but it's a beneficial kind of thing. And then you notice that, you know, such people have several issues, muscle aches, pains. They can complain like, I'm feeling bad here, here, here. You know, in medical school, we used to call it Hapa syndrome. You know, when somebody starts complaining, the complaints are everywhere. Because the muscles are weak, the muscles are not, you know, they are not strong. Because also estrogen as a hormone helps in putting calcium in the bones and also enhancing the muscle function. So the muscle function will be
so meaning this is the time for real exercise.
Yes, apart from exercise, you need to take supplements or diet, which is rich in terms of calcium. Yeah. So menopause, it's very stressful. Women actually don't sleep. Others because of hot flashes. The whole night you are literally awake. If you had issues as partners in the family, this is the time you find a 72-year-old Mogeni divorcing the wife. And thinking like there can be a solution somewhere. It's because, you know, even men need to understand this. They need to be supportive to their partners. Because at that point, you know, somebody is sweating until the whole body is wet. Because of the condition. And, you know, they can't sleep. You'll find somebody has taken 3 weeks and they're coming to console us. I can't sleep at all. So we have, you know, we have what ways of trying to help them, which I might not necessarily discuss here, but they can, you know, if they see the doctor will treat every patient according to their symptoms. Because we do not want to replace an artificial. There are studies which have been done where women were tried to replace the estrogen we are talking about. And it did not end well. In fact, it was done amongst nurses in the US. And very many nurses across that country that time. And they noticed that when you replace actively, sometimes you end up with heart conditions, high blood pressure, cholesterol, coronary heart disease, and many other things. Then they slowed a bit down.
Because many women during that season actually just love referrals. They go and begin to take it, and it can easily affect you.
Sure, that's very true.
Yeah.
So what's the most important thing is that keep in touch with your doctor.
Yeah.
Let your doctor try to modulate what is the most severe symptom. It is a season. It usually comes to an end, and the people don't realize how it came to an end. But we can address symptoms, and the way to address symptoms, we are trained to do that.
Okay.
So it's not good just to listen to saloonists and the other people. It's not that I'm looking down upon them, but for some reason I've realized this is one group of people I needed to engage as a doctor, because if I give them the right information, they have a lot of influence especially including even sexual advice that they give to our clients.
That's very true, Doc. And this conversation, I realize it cannot end actually, because we have not even started touching on the issues of the prevalence of cancers in women and all that. But I just want to engage our audience. And do you have a question up to this far before we move forward? Do you have a question up to this far? Something that has not yet been answered yet? Barbara, do you have a question?
Yes, I do. And my question is something you've touched quite a bit on it. And one of the questions is, there are some women who say or report they were expectant, and then at some point it's like there was no pregnancy, but they had all the signs of pregnancy. So what would be the reason to that? What happens until you experience all the symptoms of pregnancy? Even your tummy will start growing, and then you're told like there was no baby. There was no baby at all. And then, like you said, having a monthly menses is good. I find that these women who after birth maybe they stay for even a year. So, and there are those who they'll resume their menses immediately, maybe even at 6 weeks. So what contributes to that? And is it that one who takes like a year is exposed to some sort of risk?
So
then, the last one, you said the clinic begins immediately you are expectant. But I think when you're working with your personal doctor, it is very possible.
Yes.
And now when you go to just the reproductive health, even here at MTRH, you are told you wait until the pregnancy is at least 3 months. So that at that time you're sure we have a pregnancy. And then we can now do the test. Before the 12 weeks it is unstable, something like that. So I think that is something that also need to address. Maybe,
Okay.
Thank you. I think I want to, let me just address because I have not written them.
Okay, good.
So let me begin with the last question. I think I explained the rationale behind why you need to immediately come if you become pregnant. I even went as far as saying that you need to, before you become pregnant, you need to begin the clinic.
Yes.
We call it the preconception care. We need to erase many other things which will affect your pregnancy. And that drives me to the second aspect. Many pregnancies are lost. In fact, we call it pregnancy wastage. Because we do not plan for pregnancy.
Okay.
And some people just periods delayed for a few days could have been pregnant, which is getting lost. Because you may have not even gotten to align yourself that there was pregnancy. So there are pregnancies which get as early as immediately near where you are expecting your periods. And almost more than almost 70% of women will have for some reason, experience a pregnancy loss, some without their knowledge.
Oh,
Yeah.
okay.
So that's why it's very important, and I keep on insisting that your pregnancy journey needs even to begin before you become pregnant.
Okay.
Secondly, most pregnancy losses which happen below 12 weeks, they happen because of these environmental, nutritional, medical, and other factors that we talk about, which affects the genetic component of the sperm and the egg. We call them chromosomal abnormalities, up to 80% of the pregnancies. So you find that the baby is congenitally malformed. You know, congenital we mean inside has got, because of the genetic makeup at that point, the baby is malformed to the level that, you know, the first organ to develop is the heart. And that's why we say viability is the ability to demonstrate that there is a heart rate for us. That's why we do an ultrasound as early as 6 weeks.
Oh, 6 weeks.
Yes.
Wow. Okay.
So that to determine viability of a pregnancy, is it viable? Is it in the right place? Yeah. And when a baby dies inside the uterus, will die because the heart has stopped. Yeah, which might indicate that there were severe malformations. Malformations, we mean abnormalities of the heart. And we see that in what we call syndromes. I mean, babies with, you know, where chromosomes do not join properly. We talk of chromosome 11 and trisomy 11, trisomy 18, which have got serious implications on the heart. The ones which survive are Down syndrome, which you guys see in the population. Those ones, a number of them survive for some reason. We call it trisomy 21. All these things, we have got the capability to determine the course the pregnancy can take. In fact, right now in MTRH, for instance, we have a unit which I chair, which I'm the HOD. It's called maternal-fetal medicine. Maternal-fetal medicine is where they track these pregnancies right from the beginning. These ones especially, which have got risks, all the way to delivery. 11, 12 weeks, those 3 months we are talking about, they are checking whether they have those Down syndromes kind of thing. They can determine that. Yeah. And then the other question was on, I think we've addressed the...
Last one was, you have all the symptoms.
Oh yes, you have all the symptoms. So there is 2 elements there. It could be an abnormal pregnancy and non-viable pregnancy. Non-viable pregnancies, we have things like blighted ovum.
Yes.
You know, where there is no heart, there is no nothing, but there is an imitation of a pregnancy. Or you have what we call missed abortion. The pregnancy began, the baby died immediately, but it is hanging in there. Yeah. And then the last one is a controversial one. It's what we call pseudokiasis.
Yes.
Pseudokiasis is where there is some psychological, let me call it spiritual kind of thing, where a woman, for some reason, believes that she's pregnant.
Yeah.
Acts pregnant, walks pregnant. Yeah. Actually becomes, does not see her periods.
Yes, yes.
The abdomen grows psychologically, yeah, and can do what we call imitations. I recently traveled outside this country to a country called Nepal, and there was a very nice case presentation about that case.
Okay.
And what came out is that even it was put on newspapers. The lady went as far as saying that, you know, she came to the hospital and pretended that she has delivered, and then blamed the healthcare workers that they have stolen the
baby.
The baby. And it was all in news. The husband was an engineer. And, you know, it makes everyone It creates a very difficult kind of situation.
Yes.
That is a topic on its own. Pseudokiasis is a very controversial topic, and it's a topic on its own. Sometimes it happens.
Why, when you're saying, like, just go and confirm, am
Yes.
I really pregnant?
Yes. Now you are saying the right thing. That's why we want to do an ultrasound at 6 weeks.
Yes.
We do not want you to come and tell us that I'm pregnant. Can't you see?
Somebody has stolen my
So the fact that your abdomen is big, it doesn't necessarily translate to pregnancy. But there are those psychological aspects which are actually dealt with psychiatrists because it's an abnormal kind of thing in you. Even you do not understand what's going on in your life.
I hear. Wow. Do you have a question? Yes. Okay.
I have this question. You mentioned that it is good for a woman to have at least 9 cycles per year. Now, I wish to ask concerning this birth control of the people, where a woman can stay like 4, 5, or even a year without having medicine. So, don't you think it is more of a problem and not really helping this woman? You know? Yes, this birth control method.
So the
secondly, there is this aspect where the person experiences severe headache during intercourse, especially at like not at the beginning.
Or after the intercourse?
No, during the intercourse. Yes.
Oh.
During the intercourse, I've heard of people who are saying they have a very severe headache. So I don't know what could be the cause of the same. Thirdly, the third question is concerning menopause. In most cases, you would hear a woman saying she's in menopause. So, and you realize that most of the children for these women were conceived during that period. So when does this, I mean, how long is it supposed to be?
That's a good question.
Can a woman really say, I'm done with, I'm now in menopause?
Yes, good.
So let me begin with menopause because that was my reproductive health journey that I was taking you through, and I'm sorry for not making a comment about that. So in Kenya, and averagely, women begin menopause from 45, 46 years to 52 years. But throughout the journey, when you are possibly reproductive, we are supposed to prevent conception using family planning. Ama contraception, which you have also mentioned, which I'll address in the other question. So what that essentially means is that, again, your journey with your doctor, they have what ways of determining that you've reached menopause. But roughly, clinically, menopause is thought that if you have had a whole year of no menses in that age group, and maybe you are experiencing 1 or 2 of the symptoms associated with menopause, we will conclude that you are a perimenopausal. I mean, you are just beginning menopause. But chemically, we have a way of determining in terms of looking at one particular hormone we call follicle-stimulating hormone. We can test to confirm. But usually I advise my patients that they can stay with that IUCD or that family planning method for a year also to be sure that they are off the trap. And then you mentioned the things to do with family planning, which I do believe is also another huge topic.
A huge topic.
That one might require a day of its own. I'm actually, my thesis during my postgraduate, I did on family planning. And I was trying to see, because of the way of our health-seeking behavior, which I mentioned. Once a woman leaves the hospital, you've delivered, you go home. Other things come up. The next thing you realize is when you've started having your periods, you miss your periods, and then you start thinking, I might be pregnant. Actually, you can come and we realize you are pregnant. So usually we were, from my research, we were offering family planning, which is safe during breastfeeding. immediately after delivery.
Okay.
That
So
time you are
immediate.
excited, you say, Mimi start member 10. We ask you, what can we do for you? And then you give us the option. We look at the option and see whether it can be used on.
Yes, and I like that when you are saying you go to your doctor and the doctor looks at the option, because there is no good family planning or bad family planning method.
You're right.
It depends with the individual woman.
No, you have to undergo assessment. There's what we call medical eligibility criteria. So we take you through some criteria to see whether that method is safer for you than the other methods.
Yes.
Yeah. So the method you mentioned, the depot, was commonly used by women, but it's not among the best, sorry to say, for the reason that it was very convenient for the clinician just to inject you. You know, the pain is not theirs, it's yours. And you come back 3 months, but we do not have anybody those are hormonal methods.
Okay.
When they are hormonal methods, they have effect on 2 levels. They can have 3 levels. They can either have an effect on the brain, where the signals are produced, or they can have an effect on the ovary, which we mentioned produces that hormone we call estrogen. Or they can have an effect on the local part, the inner wall of the uterus, which is shed. Like depot works by thinning the inner wall of the uterus. Becomes very thin as a paper. So sometimes even people suffer from breakages. You know, if it breaks, it bleeds. The same thing for an implant. Yeah, and any locally acting, like we currently have a local system we call intrauterine system.
Yes.
Commonly known as Mirena in the market. It also acts locally. So such methods can cause some bleeding, unplanned bleeding. Yeah. But you've mentioned that some people, once they get injected, they can miss periods. That's true. Because the working of some of those hormones are in such a way that they thin the inner wall. So there's nothing to bleed. Yeah. But during that time, you know, you are not ovulating. It's like quiescence, you know. It's like they are taken the uterus into some form of holiday. But that cannot be correlated to polycystic ovarian syndrome, because polycystic ovarian syndrome, the active hormones are still on. It's only that there is some mild kind of imbalance. So I will still, you know, when you are using a method, it's understandable. But if you are not using a method, your doctors have to work to induce periods. At least you get some minimum number of cycles. To protect your inner wall.
Okay. That is well understood. And this aspect of the pain, could it be psychological?
Yes. Yeah. So sexual pain. Is it sexual pain or headache? I had 2 things.
During orgasm.
Yes.
Okay.
So, you know, orgasm is the ultimate pleasure point of the sexual cycle. Which after, you know, for those, if you read, sex has stages.
Okay.
Yeah, you know, there's a desire. You can have just a desire for sex. And sometimes if that desire is not fulfilled, you know, people get fixated, you know. You can find people annoyed. Yeah, that's psychological. Okay. Yeah, and then there is, you know, after desire, there is another step until you reach orgasm. But orgasm is a stage which you do not have control over. In terms of medicine, we call it autonomic. Autonomic is some nerves which just send some storms which you cannot control. There is nobody. If you reach orgasm, you've reached. You cannot control it. You cannot stop it. Yeah, all those things you guys talk about, noises, those things are not controllable because it's a stage of sex. But it is controlled by the nervous system.
In the brain.
In the brain.
Okay.
Yeah. But one thing happens. By the time you reach orgasm, there is a way your body organs respond to these things. So blood flow leaves the brain
Okay.
and concentrates on your genitals.
Okay.
If you are a man or you are a woman.
Now I see.
So everything is directed there. The attention from the nerves, the attention from your heart, the attention from everything goes. The reason why the blood is pumped very fast is towards that direction. It's not for anything else.
Okay.
Yeah. So that everything there is maximum concentration
Yes.
for everything that is needed at that point. So at that time when you losing blood circulation in the brain, the brain misses a bit of oxygen.
Yes.
So you're likely to end up with a headache.
Definitely.
Even if it's not headache, you might,
Shock,
after
yes.
orgasm, some people are not the same.
Yeah.
Yeah, they might be a different person
Yeah.
after that for just a moment. Yeah, but it is reversible headache and such kind of thing. But you also mentioned the pain at the beginning, thing which we need to. Earlier on, I mentioned that when you have conditions like endometriosis,
Yes,
you can suffer from
Pain.
sexual pain. But that pain is deep pain.
Oh.
The pain of endometriosis is deep pain. But some people suffer entry pain.
Okay.
And entry pain is a result of many issues.
Okay.
Part of it can be even, some mild infections like yeast infection, which is very common in
Yes.
women.
Very common.
Yeah, yeast infection can cause some inflammation, and therefore the skin around there is very painful. It can also be rough sex and traumatic sex.
Yes.
We usually say that sex for women needs to be a considered kind of activity. Because if a woman is not ready for sex, you'll hurt the woman. So on this one, it requires that, there's adequate preparation. Sex only needs to happen if there's lubrication. If there isn't lubrication, there is likely to have trauma. And even this lubrication is equally protective. To say if for some reason you are engaging with somebody who's likely to transmit an infection to you. If you are well lubricated, you have got high chances of escaping an infection like HIV.
It's a protective mechanism.
It's a protective mechanism.
Okay.
But if you are having dry sex, you will end up with cuts.
Yes.
And therefore you'll end up even with that HIV
Yes.
very easily.
Wow.
Yeah.
There is so much.
Yeah.
Like I feel women, we need like a 3 hour,
That is true.
A 3 hour. And I think we really need, I want you to comment on the comment section, woman, and I want you just to highlight some of the topics that you would want us to discuss more on this, gynecological issues and reproductive health issues, because we really want to meet to, the basic woman as possible, like an individual woman, if possible. And also, you can connect us to platforms where we can be able to share this information so that we are able to help women. But now, Doc, I think now what we've not discussed more about is about contraceptive and about the prevalent, cancers in women. And I think I wouldn't want us to begin on that. But there is this aspect which is basically my main point of interest still, and I want us to conclude here as we get to the quick questions to just help our audience know more about you as we conclude. But we have talked about women who are not able to take in and are missing their reproductive age because maybe of other commitments, and then they realize now age is catching up and they can be able to freeze their eggs. Yes, that's okay. But also, I have noticed that we can also freeze embryos, where now people, you got married maybe at 35, you are able to get your first child, or maybe you are not able and then you went through the IVF and you are able to, reserve the embryo, you are sure this is your husband, you have decided this is my commitment to this person, so you fertilize the eggs and then you freeze the embryos so that when you need to get pregnant, it just becomes very easy. I want us to just tackle on that, because I realize even many women suffer secondary infertility more than first time infertility. Yes.
Yes, I absolutely agree with you that because this is health education to the public, I can arrange to be available for comprehensiveness of the other remaining topics. But on matters embryo storage, I think that's also another technology which is available even in the country. Because the moment we try IVF on an individual, what usually follows is that using some technology, we join the sperm and the egg and they create the embryos. These embryos, sometimes they are put 2 or 3 into your womb. And the rest, if for example we had 15, they are stored. If your cycle fails, they'll use the remaining ones.
Yes.
So, and for any other reason, if you get a lady who's unable and there's consent from whoever had excess embryos, they can be tried on another patient with consent from the patient and the donor.
Like surrogacy.
Yeah.
Okay.
Yes. So I think on matters infertility, it's also another very wide topic. Yeah, because we haven't touched on other aspects, including the male side of infertility,
Yes.
which is very common. Yeah.
Okay. And like if a woman is having an issue, the husband is having an issue of erectile dysfunction, so what would you advise such women? Because I meet most of them and they just don't know what to do.
So erectile dysfunction, from my experience, I've come to discover that it's interpreted differently by individuals. For some men, they feel like erectile dysfunction means if they are unable to erect immediately after ejaculation, which is actually a normal thing. That after ejaculation, part of the sex stages is resolution. Resolution means everything just disappears for a moment. And maybe sometimes some are under pressure from their partners that why are you, maybe they did not get to where they needed to get at the same time. So you find you are resolving, somebody else is hiking. And then there comes a problem and some people start concluding like they have a problem. Maybe they might need to discuss on how they go about their process. That's not erectile dysfunction.
Yes.
Erectile dysfunction means inability to, to enlist an erection.
Okay.
So erections come about, looking at it comes by desire. For men, you're looking at a woman, she's nicely dressed, she's, she's giving you a chance to make a step towards her. And she's creating a situation which is enticing. Every man, some signal goes through their brain. And what can follow immediately if they feel like they are wanted is an erection. That their circuit is that short. Unlike the women, by the time a woman also, let me say erects, by the time a woman gets to that kind of feeling, that blood circulation we talked about, and those things are happening, ready for sex. A lot will have gone into it. It's not that short like for men. Men, it can just happen within a span of a moment. Because, if a woman behaves very well and very receptive, the man clicks.
Okay.
But erectile dysfunction, true erectile dysfunction can happen as a result of some medical conditions. Like diabetes, which has affected the nerves. The sugars affect the nerves. The nerves are the source of signal to the blood vessels.
Okay.
For a man, it's blood circulation. Once there is blood circulation to the penis, it erects. So if you have diabetes, for example, it can be a problem.
Okay.
The other thing is there are psychological elements. For example, some people have argued that if you put your man under a lot of pressure to perform,
They don't show up.
they give up before trying. You shut up their circuit.
Okay.
Others use drugs. All the various drugs we have talked about, they can affect that. Others are undergoing some chronic kind of diseases which are being treated, mental and other things. Some drugs for high blood pressure can affect erections. Yeah, and so when they have this problem, they need to come to their doctor so that we do a full assessment and then see where their problem lies. Especially if they have diabetes, there are things we can try. I will discourage over-the-counter prescriptions of drugs which we call sildenafil, but you commonly know it as Viagra. They can kill you if you are using it, and especially if you have a heart problem, you'll die. So when those who come to us and we screen them through, among the tests we do is to do an echo, ECG, tests of the heart to see that the heart is functional. Why? The drug works also by increasing the volume of blood in those areas. It dilates the blood vessels. So if that happens and you have dilated blood vessels, your lungs can just be packed with blood and you'll stop breathing and your heart can stop.
So even women should not become the doctors of their husbands.
Yes,
and encourage them
they should not go to the chemist and just buy for their husbands. They should just encourage them. Because men rarely actually seek health care. By the time a man comes, that man really loves the lady, has really searched his heart and says, no, I'm not performing. But also some ladies create very complicated situations for their men. Yeah, especially if you tell your man that you are not performing, you are that man is literally walking dead. Yeah, I think there's that super psychological element in it that needs to be taken care of.
Wow.
Yeah, and then
we actually imagine sex is psychological for women. We don't imagine sex is psychological for men.
No, sex is the same for men and women. There is what we call brain sex. Sex is not the activity. Sex is in the brain.
Okay.
Yeah, I think that's what I can tell the listeners. Sex is in the brain. If you've not had sex in your brain, you will not have the physical sex. That's like nothing. Yeah, but once you are satisfied in the brain, it doesn't matter. Even if it is those other ones, they talk of premature ejaculation, those 2 seconds are important if it was satisfying to the lead in the brain. If you had it also in your brain, it can. Of course, you get a bit frustrated. But you see somebody who is satisfied, they will be satisfied because it's a brain thing. Yeah, we call it brain sex.
There is a lot. But this is just to tell you, woman, we got you. We got you. We have your back. And this is a platform where you can learn. This is a platform where you can express yourself. This is a platform where you can also get solutions to everything you're going through. Yeah, we are not just interested in your spiritual growth. We are interested in your holistic well-being. That's why we say that in this era of the cutting edge woman, we are coming to unbundle you as a unit, like you as a woman, what you go through by the time you wake up and by the time you're getting back to bed. And we are creating curated conversations that are able to minister to you throughout your entire day and your entire life as a woman. And so Dr. Richard Mogeni, we are so grateful for that section. I already feel I wish we had a part 2, but trust me, I will do my best to bring Dr. Richard for part 2. But I just want us to conclude this conversation in this way, because now, Doc, you've been giving us medical information, but we also just want to know a little bit about you, and I want to give you 5 quick scan questions, and you can tell us this. We just
I
want
hope
to know.
there is questions.
They are easy, and feel free to just maybe answer with one word or a brief explanation. Are you a morning person or a night person? Whatever that means to you.
I don't know what that means to me. I'm both.
You are both.
I should suspect.
Oh, you have no problem.
Yeah.
So how much time of sleep do you get per day?
Oh, I think my profession has destroyed my sleep time. So if I did 6-7 hours, I'm okay.
Oh, 6-7 hours.
Yes.
Wow, good. Next, we would like to know what are some of the activities you do outside your profession? Like now, I can imagine. I really want to know, how do you recreate? How do you, rest?
Also, the way I debrief myself, because usually we interact with a lot of problems throughout the day. Whenever I reach home, if it's before sunset, I have a chance to walk around my natural fence. I like nature, natural fence. I have whatever little farm I have, I like enjoying seeing plants grow. When they dry, I like watering them and see them come to life. I have in this town even planted some bananas.
Wow.
And I usually, every Sunday, I'm at my little banana farm. It's half an acre. And usually I'm enjoying, supporting the bananas, pruning them. That's how I spend my Sundays a bit. Wow. And also just walking around. I have what small, things that I do. But besides that, I like socializing, especially in groups, like, these social groups, people form small groups. Spending time to them, sometimes I realize that giving them some, sometimes sharing a bit of your experiences, be it your financial encounters, your spiritual encounters, parenting challenges, which everyone I've realized goes through, or of some sort. It helps, and of course also attending, some seminars and CMEs with my colleagues. Sometimes I'm a presenter in some of them, trying to educate the other colleagues on some of these things.
Oh, good.
Yes.
That's wonderful. I also want to know, how do you manage to keep so fit, I think the first time I met you, in the same way you are, like, how are you able to balance? Because I believe that the kind of work that you do, you need to be energized. How do you keep your energy levels and manage just to keep fit,
I'm not sure that I'm fit. Nowadays, I feel like I'm very unfit.
Really?
I travel outside this country and I thought I have added 3 kgs to...
Only?
And in that country, I had it's so hilly. I really enjoyed, scaling.
Wow.
The hiking, the mountain. There was even a place where they said 1,000 steps. I did it 2-3 times.
Wow.
And it was very nice. But here at home, I have recently, because of those 3 kgs, I've recently developed a program, a whole family program. Because I don't have time these other days.
Yes.
I have dedicated that the first thing we do on Sunday morning is to do 1,000 steps, 10,000 steps.
Wow.
Of walking. So you can literally walk almost from home to town.
Wow.
And the park. So we walk the whole family.
Wow. That's good.
Just to induct the young ones to have a sense of exercise in it. But beyond that Sunday, because it's the only day I have, I'm very active in my little gardens and shop. I think I do the work for a whole week. But in the hospital, usually park my car and I have set some number of steps that I have to do in terms of walking. Just leave it somewhere in parking. Walk around the hospital whenever I'm needed. I just try to walk very fast and manage to do some what I call cardiac exercise at least. But with that does not necessarily define me as a fit person. When I came back from outside the country, I realized my wife was very busy exercising. I joined her a few days. I don't know. I think she also gets discouraged once in a while.
Yeah.
But I learned that actually you can do in-house exercises.
Okay.
You can do chair exercises. I bought a ball. If my son wants to play, I'm just trying to look for very difficult ways of trying to exercise. So during COVID, we were so scared that we were going to die like everyone else.
Even you.
Yes, because it looked, we were the frontline guys, and we had started writing our wills as the healthcare providers. So out of that scare, there was this idea that if you exercise, you might, we felt like if you exercise, you will remain alive. It was that bad. And, I was forced to make use of my little savings for health. So I bought a treadmill into the house. The unfortunate bit is that, like now I live here, it's late. So sometimes you are not able, but at those times we participate. We also try to participate activities like these runs which happen in town. And the good thing about it is that because participation, you'll embarrass yourself.
Yes.
Because you are unfit. So it forces you to even exercise on that treadmill so that you are able to participate. So it creates a bit of commitment to that, but it's very challenging.
That's so intentional. That's so intentional. And I think it's inspiring because I really wanted to know what is the secret here with your busy schedule.
But I'm not fit. You should not declare me fit. I doubt whether I'm fit.
Okay, you've maintained. You've maintained the weight. So now, I think this is the last question, but I want to know what comes to your mind when you just tell me what comes to your mind when I mention this word. They're just two words. Yeah, they're related with what you do. But I want you to tell us, like, what comes to your mind quickly when we mention the word mother?
I see a source of life.
Wow. Family.
I see love.
Wow. Hey, that was so fast. That was so fast, but we've come to the end of this conversation and this interview. You've heard that you can find Dr. Mogeni at MTRH. You can attend the clinics there the second Tuesday of every month, and also the last Tuesday of every month for those that are seeking health solutions in fertility. You can also find Dr. Mogeni at Fountain Healthcare, and that's where he does his private practice. But we have his contacts on the screen currently. We want you to pick that phone contact, and in case you need a gynecological review, kindly reach out to Dr. Mogeni. He's one of the best, and we guarantee you that he will be back. I hope that we are able to get him back, but I guarantee you he'll be back, and I believe he will be able to sort us out. So thank you so much for joining us. I've been your host, Pastor Patricia Wanyonyi. Bye.
Thank you very much. Thank you for the opportunity to interact.
Amen.
Thank you.
Karibu tena. So we are done. That's it.